Elizabeth, how the global community is facing this emergency?
Well, I think to start with, on top of all the concerns other families already have, with work, family, how to look after each other, in the Duchenne community, at least in the beginning, there was a large shock like, okay, they say this disease is very dangerous for people who have lung problems, cardiac problems, who are immune suppressed. And we as parents and families and men themselves thought like, oops, we have all three of them, So I think the first shock was, are we much more at risk than other people? So I think that really made it, we felt like we need to discuss with each other, we need to learn from each other, how can we survive this crisis all together as a global Duchenne community? And we are there to help each other, That was the feeling we had in the beginning when it started.
And what the World Duchenne Organization is doing in this moment?
So what we started to do is to listen very good to all the different organizations around the globe, like what kind of information do you need? What are the worries we have? And we had a lot of worries, as I just said. So we were very fortunate that the best clinicians and experts in the world were there to help us and to explain to us, like, this is what you can do. This is what it might look like. We are not sure if boys with Duchenne are more at risk, especially the younger ones. We really don't know. Then we kind of, in next steps, we thought like, but what if a boy with Duchenne gets affected, or a man or a girl? What should we know? What should we do? What should we have in place? And then there was another webinar we organized, for example. We organized 4 webinars so far, but another webinar was about like, what if you don't get a place in a hospital? Because if you have non-invasive ventilation, in general, they won't allow you with such an infection like the corona in a hospital, because you might spread the virus. So then again, we had specialists speaking about how could you in your country, as a patient organization, discuss with the hospitals that the boys and girls and men could still enter the hospital. So that is what we have been trying to do. All the questions and concerns who are there, to give realistic answers to that. But nobody is an expert on corona and Duchenne, as it's really, it hasn't happened to us before. We don't have experience. And I think, and they say, knock on wood, I will do it now, is that so far it's the boys and men with Duchenne do well. We don't see a lot of Duchenne boys in a man in a very bad condition because of COVID. So let's hope and pray that it will be like this. And meanwhile, we fight for that all facilities are there and all knowledge is there to look after everybody.
And what are the general issues that the families are facing, more in terms of social issues that they are facing?
Yeah, well, I think like in every country, of course, it's different. If you have a total lockdown, that's for everybody the same, whether you have Duchenne or not. So you have the same social problems as everybody. But on top of that, there are also countries where people can go out still if they keep a distance, but that's too risky for the Duchenne man, so they will stay in. But also with the helpers, you cannot... where people were used to have a lot of helpers from outside coming in, that's now a high risk. So a lot of families decided not to have the caregivers from outside anymore. But that puts a huge burden on the families, and it's exhausting, So that is, I think, what is happening a lot. And also we see like brothers and sisters who are still working, or having a job. They can't come back in the house anymore because people feel like, oops, what if they bring in the virus from their work? So I think on top of the other isolation everybody is in, it's more for the Duchenne community. On the other hand, we are more used to it. We are already very good and creative in kind of the isolation, because Duchenne men and boys are more at home and less going out than other people, and they have a fantastic character most of the time. So I think they deal with it quite well.
And how important is the community in this emergency?
To me, I think it is super important because nobody really understands what you are going through. Of course, people know the COVID and it's scary, but they look at it from a different angle than we do. We really feel like, oh, what if our boys get ill? Where can we learn from experience from others? We are really, looking everywhere and reaching out to everyone. Can we help you? But also, how can we learn from you? How can we learn from people in other countries where the care might be different? So we need each other more than ever, I feel.
Is there a message that you want to share with the Global Duchenne community?
Sure. First of all, we stay at home for Duchenne, and we have to encourage the whole community and all our friends to do so. But also, stay strong. We can do it. Together we can do it. We are a very strong breed. We have gone through, every family has already gone through a lot, has dealt with the diagnosis and the shock of the diagnosis. So we can do this as well. We can do it together.